Good morning, everyone. This is Gail Dudley with your news in motion. Today is July the 27th, 2021. It is a Tuesday, people. It is that happening Tuesday. And boy, is it happening today. Y'all, I cannot wait until you hear from our guests today. Had an opportunity to get on with them around 7 a.m. this morning to just work through some of the things we're going to talk about. And I'll tell you right now, it's going to be amazing. It's going to be amazing. So come on in the room, people. Come on in the room. Let me know who's in the room. What do y'all call it? Y'all call it romper room. Y'all be taking me back in the day when y'all call this romper room. Good morning, Tracy. Good morning, girlfriend. How are you today? Good morning to you. Good morning, Kim Keels. Good morning. I haven't seen you in a long time coming in here. What is it, Charlotte, North Carolina? How are you doing in North Carolina, girl? Let me know what's going on now that you've been on your long extended vacation. You're back at home. Good morning, Julie Bryce. Good morning. Good morning, Lori Wallace. Good morning to you. Good morning. Good morning, Oscar. How is it in Baltimore, Maryland, sir? Good morning to my biological brother, Louis Pryor III. Hey, that's women in the Olympics last night. They need to get some training in or something. I'm getting a little upset with that team. Good morning, Marion Jackson. Good morning. Good morning, Rosanna Bivens. Good morning. What's happening to you? Good morning, Diane Ladybug. Good morning. Hey, as you're coming in, do me a favor, share this video because we're going to be talking with a doctor. We're going to be talking with a health partner. We're going to be talking about COVID. Good morning, Josh. What's happening in Texas? Good morning, Hester. Let's see, you're in North Carolina too. Good morning, Kenny Stanley. How are you? Y'all coming on in the room this morning. Do me a favor, y'all. Take this video, share it. Y'all don't just share it. Put in the comments that there's some amazing nuggets that's going to be dropped in here today. And we want our family and our friends to hear about it, y'all. Y'all, we're in the middle of a pandemic. Some of y'all thought it was going to be over. I was hoping it was going to be over. But it seems to be what they're calling the fourth wave. Y'all want to get back to normal, but I also want to make sure that we're doing what we need to do on our end and within our community and making sure that we are communicating facts, not conspiracy theories, but facts. Good morning, Jeffrey Allen James. Good morning to you. Did you sport that News in Motion t-shirt on yesterday, brother? Good morning, Riakis. What's happening? Good morning to you. Riakis, I happened to listen in to the anniversary replay once again, and your words were just very, very rich to me. So thank you. Good morning, Pastor Antoinette. How's Baltimore, sister? Good morning, Stephanie Burbridge Hall. Good morning to you. Good morning to everybody. I can sit here and say good morning to all of you, but y'all know what we do. I don't want to take up a lot of time because I want us to get to the meat that's at hand. Good morning, Judy Neal. Good morning, Regina Short. Good morning to all of you. All right, y'all, we got to get this party started. So let's go. All right, y'all, our quote for this week, as you know, I wanted to go, since we're in the middle of the Olympics, I wanted to make sure we were getting a quote from someone who was strong in that industry. We're always going to be thinking about Jesse Owens. So here's his quote for the week. We all have dreams, but in order to make dreams come into reality, it takes an awful lot of determination, dedication, self-discipline, and effort. Again, that's Jesse Owens, former American track and field athlete and 4-time gold medalist. Y'all, yesterday I showed y'all a video, and I think it's only fitting to show these 2 videos once again before we go into the introduction of this special segment. Today is a special segment talking about COVID-19 and the vaccine. So please, please, please share this video. But here's the first one I want to share with you. Y'all know we've been talking about COVID-19 since News in Motion began, which was in June of 2020. And we are continuously wanting to bring you information that is factual. We also have this video that came from the CDC as well that we shared yesterday that we want to share before I do the introduction. So please pay attention to this.
I'm getting vaccinated against COVID-19. Yes, there could be some mild short-term side effects from the vaccine. That's not going to stop me, and I'll tell you why. A little discomfort from a safe and effective vaccine is totally worth it to avoid serious problems COVID-19 disease can cause and to help get our lives back. Some people may have some pain in their arm where they get the shot, or tiredness, headache, or fever. These are no fun, but they go away for almost everyone in a day or two. These are normal signs that your body is building protection. If you have any more questions, visit the CDC website.
So yes, we're going to continue to share this information with you. And we thought it was so fitting to dedicate this entire segment of News in Motion today, talking about COVID-19 and the vaccines. So I'm so excited to welcome you, and I'll read their introduction first and I'll bring them on screen. Jakeithia, many of y'all know me talking about Jakeithia over the last several months. She was helping me here in Central Ohio, making sure that our people were getting in line to get vaccinated. Jakeithia Butch, licensed community health worker and a community paramedic. She works for the Ohio State University Medical Wexner Center in the Department of Population Health. She proudly works coordinating the OSU Community Partnership Program. She wanted me to let all of you know here in Central Ohio that she is a proud fourth generation member, believer, follower of Trinity Baptist Church in Columbus, where she proudly serves as chair of the food pantry. Y'all know I'm all into serving those who are food insecure, and multiple other committees. She has one amazing child named Ruby and a fur baby named Cupcake. I'm also so excited to have Dr. Nicholas Command, is a professor in the Department of Emergency Medicine at the Ohio State University Wexner Center. Dr. Command's clinical interest is in disaster response and emergency preparedness. He serves as one of the medical managers for Ohio Task Force 1, Ohio's FEMA Urban Search and Rescue Team, and has been deployed previously to Hurricane Harvey, that was 2017, Hurricane Dorian, that was 2019, Hurricane Laura, that was 2020. Dr. Command and the Ohio State Advanced Computing Center, say that real fast, of Arts and Designs are working on a $1.8 million grant to teach mass casualty triage to first responders in virtual reality. Most recently, he published a systematic review of the allocation of scarce resources in disasters and has worked on the Ohio Crisis Standard of Care Plan. I am so excited to bring in Dr. Command and Jakeithia. Good morning.
Good morning.
Good morning.
Good morning. Good morning. Good morning. Y'all, we don't want to prolong it. We want to jump in. So first, allow me to start with this. And they already know I was going to jump in on them, y'all. Let me start with this. The latest CDC report, which says that more than 97% of Americans currently being hospitalized with COVID-19 are unvaccinated, according to the CDC. And then we also heard from the White House on yesterday that the United States will not lift any existing travel restrictions at this point due to the concerns over the highly transmittable COVID-19 variant and rising number of U.S. coronavirus cases. So this came from the White House. Then we also had on the weekend, Dr. Fauci said that the CDC is actively considering changing mask guidelines as cases of the Delta variant continues to soar in the U.S. That's a lot. So if I can start with this question, I'm going to give y'all the easy softball question first. From what you are witnessing, should we return to masks indoors? Why or why not? Everybody wants to know.
You know, I think, Gail, throughout the pandemic, everyone needs to consider their own risk. So, you know, we work in healthcare, And so we had a very high risk of contracting COVID. If you have pre-existing conditions like COPD or diabetes, or you're overweight or elderly, you're at higher risk of severe infection. So those things really need to come into play. You also need to think about the people that are around you. So do you have elders that live in your house? Are you in a multi-generational house? Do you have an organ transplant, or are you immunocompromised from cancer? Those are people that get really sick from COVID. So I would recommend masks in, situations where there are unvaccinated people or high-risk people that have been vaccinated that are around you. I'm very lucky personally. My parents are in their late 70s. They got vaccines as soon as they could. I got a vaccine, when it rolled out to healthcare workers. So most of the people in my circle have been vaccinated, so it's safer for us. But if that's not the case for you, if you have unvaccinated people that you're around or high-risk people that you're around, you may need to continue to wear masks. So, those are kind of some of the thoughts that I have. Jakithia, what do you think?
You said the best. I think you have to know who your population is. If you're in the grocery store and you don't know everybody, put a mask on. If you think that you're going to bring something home to somebody, put a mask on. But the bigger question is, if you have people that are around you that are not vaccinated, ask them why. Because everybody needs to be vaccinated. And that's how we get rid of this. So if you have family members that live in your house and are not vaccinated, get them vaccinated.
Okay, thank you for that. Next question. CNN reported, this is the medical analyst, Dr. Jonathan Ranier. If you are not vaccinated, he made this statement on CNN. If you are not vaccinated right now in the United States, you should not go into a bar. You should probably not eat at a restaurant. You are at a great risk of becoming infected. So honestly, since we don't know who's vaccinated or not, should we just all stay at home? Not that I want to live like that, but
yeah, I don't know if we all stay at home. I think the reward for vaccination was for us to open back up and live a more normal life. And unfortunately, we really still need as public health advocates to make sure that people are getting vaccinated, because we're not to the numbers where we need to be at. The problem with not being vaccinated, in addition to you may get very sick with COVID, is the fact that these variants can continue to pass from people to people and evolve. This is a virus. It's evolved multiple times since it left where it originated, and it's going to continue to do that. And the only way it can do that is to pass from person to person and change. So one of the ways that we stop the evolution of the variants is by getting people vaccinated. Then the virus just won't have any place to go. So, I think if you're not vaccinated, you should still be wearing a mask when you're out in public. We do know that in the summer, the virus doesn't spread as much, which should scare us all that we're seeing these spikes, because, we know what happened last year in November. Things got pretty crazy because we all got back indoors. We started gathering for Halloween and Thanksgiving, and all of a sudden we saw these huge spikes of the virus. And that's going to happen in the winter to people who aren't vaccinated. We have a year's worth of experience to know that that's where it's going to go.
Yeah, well, if I can, I pulled out the numbers for this morning. It says the COVID-19 cases in the U.S. continue to rise, averaging 57,000 per day as of this morning. And even they were talking about, last week we were talking about 30,000. So now we're already up 27,000. And the week before, 4 weeks before that, we had gotten down below 10,000. And then it says deaths are remaining about 250 per day. It goes on to say that almost 90% of Americans age 65 and older, the most vulnerable demographic, have received at least one shot. So my question to you, Dr. Command, is what can we do? we're all talking about it. We have conspiracy theorists out there. People are thinking that because they now have a tremor in their finger that is because of the shot or because they were around someone. I actually had someone say to me that they now have Bell palsy because they've been around people that received the vaccine. And I'm like, where is this coming from? So can you speak to any of that?
Yeah, when I work in the emergency department and I see somebody who's not vaccinated, I like to have a conversation with them to try to figure out why they aren't. What have you heard about the vaccine? Because to be completely honest with you, December 15th, the day I got my first shot when the vaccine rolled out, was one of the biggest reliefs I've had. We go into rooms every day with people who are going on breathing machines and ventilators because of COVID. And so to have this, weight lifted off your shoulder by getting the vaccine is amazing. These vaccines, we know that 163 million people in the United States are vaccinated, and that's just such a huge number. So to say that we don't have data is not accurate. And we know these vaccines were developed over the last 20 years. The technology for these vaccines were developed for SARS and MERS and Ebola. This isn't a brand new thing that they just started doing. It was new technology for a novel virus, right? Our bodies have never seen this virus, and that's why we don't know how to fight it. The other thing that I'll just say from a medical standpoint is we've done really well with the vaccines, but we have not done well with the treatment for COVID. There's no antibiotic for it. The medicines that we have, frankly, aren't great. Remdesivir is not like giving antibiotics. It makes people maybe a little bit better. Things that we tried early on that were in the news, we know the science said don't work. So what we do have is vaccines. We have preventative medicine to prevent people from getting coronavirus in the first place. And that's why we're pushing this so hard. And I've stopped talking about it a lot with people because I know they're sick of the topic, but it's important because we don't want another winter like we had last year where, sports are canceled and the things that we enjoy doing, like gathering, we can't do that. So it is important that we get vaccinated. And, I see a comment that people who aren't vaccinated don't trust the science. The thing that scares me a little bit, and I'll be forthcoming with this, as an emergency physician, I have to spend a lot of time learning the science. So to hear someone who's not in medicine say, I don't trust the science, I sometimes would say to them, well, do you understand the science? I have people say, well, I've researched this. Well, do you really know how to research this? Have you read the New England Journal, JAMA? Have you read the studies? Because going through Google, going through social media, I don't consider that research. And so trust your doctor, trust your public health official, because they actually do learn the science and do the research. And it takes years of experience to learn how to read these studies and know, kind of what's in there. So, those are a few things that I would just say. But each of these needs to be an individual conversation with that person about why they don't want to be vaccinated. And, I try to do this in the emergency department, even though, the waiting room's full and it takes time. I know that we can potentially prevent a death or an infection by, spending some time on the conversation.
Okay. And by the way, that was Kenya Noel, and she is actually a scientist. So she's been working with me, getting people to Jakeithia to get them in. And I see Ronald Robinson also has a question. And Jakeithia, we got to hear from you as well. He says, is it true that the vaccination is only effective for 6 months? And if so, what should we do if we are approaching our 6th month?
So one of the things I wanted to say before we answer this question is, Gail, that you have helped 400 people get vaccinated. in Columbus. So not only do you believe in this and talk about it, and you got vaccinated at OSU with us.
Yeah.
So, I mean, those are the things that we can do. And if anyone is on the show that needs to be vaccinated and don't know where to get vaccinated, call me. I will help you. Even if you are not in the state of Ohio, call me. I will help you find it. It's that important to all of us. And for those people who say that they don't believe what's in the vaccination, you go get your nails done. You don't know what's in that. You go to and get your pedicure. You dye your hair. You don't know what's in that. Tomorrow your hair could fall out. Sure. You don't know any of that stuff, but you do it all the time.
Good point. Good point. Good point. Thank you for that. Thank you. So, Dr. Kamen, did you see the question from Ron Robinson?
Yeah, so Ronald, this is a great question. And as I said, as an emergency physician who was taking care of COVID patients, I had the opportunity to get the vaccine the first day. So I got my first dose on December 15th, which was the day Pfizer rolled out. And so I share this concern. So I'm, going 8 months or so out from when I got my first dose. But we continue to study these vaccines more aggressively than we've studied any other vaccine. So there's ongoing studies right now that continue to look at the people who were in the first trial. So remember, these vaccines went through clinical trials before they rolled out to us. So there's people that got vaccine in July, August, September of last year that are going on a year out from getting their vaccine. And what the studies are showing is that these are still effective. Now, I know it's been a conversation about, are we going to need a booster? Well, I think the answer is we probably will, but as somebody who's gotten a flu shot every year for the last 20 years, booster shots are a part of what vaccines do. They help our immune system adapt and remember how to fight different types of infections. So if there's a booster, it'll probably make us more immune to any type of variants. It'll boost our immune system. So for those of us that haven't been infected, we know what coronavirus looks like, and we can more adequately fight the infection.
So I was one of the people that were part of the study. So I got my vaccination in September. And every month they still do blood work and everything to see how, I've never got COVID, and I worked in the emergency room throughout the pandemic, and everything. And I've never had any problems and they're still doing blood work to see, would I need a booster or anything like that. So I would suggest to people to get in studies also. It's the best way to help.
This is great. We got to keep going. Y'all still have time, right? Mm-hmm. Latrice Jones is saying 163 million people in the United States are vaccinated. Do we know the demographics of that number? I see more African Americans wearing masks versus other ethnic groups. Excuse me.
Latrice, do you think that's because of fear, though?
Go ahead.
That people are still wearing masks. I know that in my family, everyone's vaccinated and they still wear masks because they're all like, well, I don't know any of these people who are out in the store and things like that. So do you think that that's a culture thing that we're wearing masks still versus, not vaccinated? Is that what you're asking?
Look, I know I still wear my mask when I go into the grocery store.
Yeah, I really struggle with that. So a couple things about demographic groups. First of all, as far as the vaccines are concerned, the J&J study had 13% African American, Moderna had 10% African American, and Pfizer had about 10% African American enrollees in the study. So we know, and about 15% of Latino participants in the J&J, 20% Latino in Moderna, and 28% in Pfizer. These vaccines were tested in many different demographic groups. So we know that they work in those groups. I think some of this is cultural, and I'm going to be totally honest. I kind of struggle with this a little bit because I want to model good behavior. So when I coached my son's hockey team, I was always wearing a mask, even on the ice, and I want to model wearing a mask. But I also don't want people to think that I didn't get vaccinated. So when the guidance turned to, if you're fully vaccinated, you can take off the mask, then I was proud to take off my mask. And so, I struggle with that. I think some of this is cultural. So, Asian populations, because they were affected by SARS and MERS, some Asian populations overseas were wearing masks before the pandemic.
Yeah.
So I don't know really what to make of that. When I see people wearing masks, I try to give them the benefit of the doubt. Maybe they're a cancer patient, or maybe they had an organ transplant, or maybe they're not able to get the vaccine because they've had an anaphylactic allergic reaction to a vaccine in the past, or maybe they just want the extra protection of wearing the mask. It's hard to draw inferences from when you see somebody with a mask on, but whenever I do see that, I applaud that person because they're wearing it for some reason to either protect themselves or someone else that they care about.
Okay, thank you for that. Kenya again is saying school is about to start again, and a lot of students are not vaccinated due to age or their parents have refused. What are your thoughts? Because they're trying to get everyone back into the schools, but if there's this that's happening, and now we have people wanting to fight, showing that if you've been vaccinated or not. So there's so many different variables here. Can you speak to that at all, Doctor?
Yeah, this one's really hard. My daughter turns 12 2 days after the start of school. So, she'll start 7th grade not vaccinated, and we're going to get her vaccinated as soon as she can, but she's not yet 12. So I think our kids will probably wear masks because they're under the age of 12. I have a feeling, well, at least where we're at, Columbus has talked about having students wear masks. I think it was great that we rolled vaccine out to the teachers because it helped get the students back into school. But if you have concerns about other students at the school or teachers, then you should be, sending your kid with a mask. And one of the things that, my kids are 9 and 11, soon to be 12. I was amazed how quickly they adapted to wearing masks. I think we were all concerned, little kids can't wear masks and what's going to happen. And, they got on the bus, they popped their mask on, got off the bus at the end of the day, took their mask off. And they were great. And I think, these vaccines are going to continue to be studied. There's trials ongoing right now with ages 2 and up. Mm-hmm. So hopefully we'll have vaccine for kids. But in places that are high risk, I would recommend continuing to wear that mask. One of the things that you need to know, I know you have participants from all over the country and even the world. We're pretty lucky in the United States that a lot of areas have high vaccination rates. So the county that I live in, Delaware County, has the highest vaccination rate in the state. So I'm less concerned about my kids out here than if I lived in Holmes County in Ohio that has a 15% vaccination. So there's very few people vaccinated in that county. So I think you have to assess your own risk. If you're in the southeastern United States where we're seeing these huge surges and there's not a lot of people vaccinated, then I think the children should, unfortunately have to wear a mask until we can get a little bit further along.
Okay. You said something with me. I'm sorry, Jakeithia.
I was just going to say my daughter is 19, and so it's a little older. And so in colleges, a lot of the colleges are requiring the kids to be vaccinated. And I'm for that because they live in the dorms. And so I think it's safer that way.
Okay. Yeah. Yeah. Doctor, you were sharing with me earlier when we did checking our mics and things earlier. You were talking about the World Health Organization and their plan to have rolled out the vaccines a particular way. Can you share that with the audience? And I'm going to have to pop up something up here with Latrice Jones in a moment as well. But can you talk about that for a moment, please?
Yeah, so I'll start by saying we're very lucky in the United States for many reasons, but we have excellent healthcare infrastructure and we have an abundance of vaccines to the point where you may have seen on the news that we have vaccines that are about to expire that are going to get thrown out. And I did a talk last Friday for a disaster group in Africa, and Africa actually has a 2% vaccination rate. And that's not by their choice. It's because they don't have vaccine. And we can walk about 5 minutes from anywhere that we're at, unless you're, I guess, in a very rural area. Vaccines are available in this country. And we shouldn't, I think, take that for granted. There was a time when vaccines were at ultimate scarcity where, we were allocating vaccines to the people who were highest risk, nursing homes, healthcare providers. But now we have enough vaccine for everybody. In fact, there's enough vaccine in this country for people to get 4 vaccines each person. But the World Health Organization really wanted to roll this out in a more equitable fashion so each country would get enough for 3% of its population and then 20% of its population. And we got lucky because we're a country that has a lot of resources that we were able to open to every American by March. And again, when I was talking to this group from Nairobi, they were really frustrated with the ethics of how do some countries have so much vaccine that it's sitting on the shelf and people are dying here. And I think that's, something that we need to remember is we have the treatment for coronavirus. It's a vaccine. It's not a drug. We don't have that yet. And we're very lucky in this country, at least, that we can go to the corner and get a vaccine. And I'll be lucky, if the studies do show that I need a booster, I'll be able to roll into work one day and get the shot and then go work. So I think we need to think about that. I think the Olympics, you mentioned the Olympics to start with, and Jesse Owens, who's an OSU grad, which was a great way to start. The Olympics gives us an idea of more of a global perspective. And, there are people that showed up at the Olympics that couldn't roll into a Walgreens and get a vaccine. So it just, allows us to think about how lucky we are that we have this opportunity and not to squander it by believing what we see on social media.
I agree with that. I know I was looking for a vaccine for the longest time. And the moment I would think I would get an appointment, it would be gone. I was like, what is happening here? And then, hey, Jakethi, I heard me speaking and said, hey, I can help you out. I said, I'll be right over. I want to share this because we are running out of time. And this has been great. So I'm going to just have to have you two back. Latrice Jones is saying Black people do not trust vaccinations because of the history in this country, Tuskegee experiment, for example. I think that's why more African Americans are wearing masks because they don't or won't get the vaccine. Do you think that plays into it at all?
I think it did at one time. I know that when it first started and the vaccine came out, lots of people had those worries, especially the older generation. But now we are dying at a rapid rate because of this. So the question is, are we going to trust modern medicine now, or are we going to die from this? I mean, those are your options. It's real simple sometimes. And I am so sad that it's that simple. But like I was talking to my 92-year-old grandmother, and she didn't believe in the flu shot until she got the flu. And I'm like, those things can kill you now.
Right.
And she's fully vaccinated.
Yeah, I think it's unfortunate. The Latino population also has some trust issues, and we can't deny that the past happened. And so what we can say is, those things that happened in the past are real for sure. But these vaccines, like I said, I think they did a good job of making sure that different races, ethnicities, ages were included in all the studies. So we can say 20% of the participants in all the vaccines were Latino, over 10% were African American. We had a broad group of ages involved, and we know that these are safe. So yeah, breaking down those barriers is why we're trying to do this, is to try to get the education out that they're safe.
And one of the things that I'd like to leave with everybody is that be a part of medical studies, because there is a lot of studies that don't have African American people in it. And it is sometimes hard to get research about what helps us if we're not at the table. And the only way we can be at the table is by being at the table, volunteering to be in a study. It's the greatest way to get, one, free medicine, two, be a part of groundbreaking information. I got the COVID vaccine before everybody else did. I got it in September. And so those are the kind of things. And now I'm part of history because of that study. And there are other studies that are always out there. There are OSU and all the other hospitals are always looking for people to be a part of studies. It doesn't cost anything. Sometimes you get paid to be in a study.
Right. This is good. Just real quick, we have Elizabeth Town saying, I'm having the hardest time convincing my 22-year-old and her friends to get vaccinated. Any thoughts on trying to help her get that making that happen?
Let me show her someone who has to be intubated because they can't breathe, or someone who has lost a person because of COVID.
Okay.
Yeah, and the other thing I just would throw out there is, I've heard this a lot. The vaccines might cause this, that, or the other thing, and we know that COVID causes a lot of problems, and a lot of people get long-term issues from COVID that we don't understand very well. But we know with the vaccines that you're unlikely to get COVID. So even in a 22-year-old who's pretty healthy, they can get sick from COVID. And I don't know, I always use sports analogies because that's kind of the world I live in, and I'm a Clevelander, so I'm a Cleveland sports fan. But Myles Garrett is probably the healthiest guy that you could see. I mean, he could run through a brick wall, but he missed about a quarter of the season because he couldn't breathe because of COVID.
Right.
And so even in young, healthy athletes, we know that they can get sick from COVID. And the other thing that I would say, about this younger generation is when these folks don't get vaccinated, that's where the virus is circling, and that's where it's evolving, and that's where the variants are developing. And I think in public health and in medicine, the thing that we're most terrified of is a variant that the vaccines don't work against. And we know the vaccines are effective against the Delta variant. You might have a breakthrough infection, but you probably won't even know that you're infected. But heaven forbid there be a variant that makes people super sick despite vaccination. And that's what's going to happen if enough people don't get vaccinated and the virus can continue to evolve.
Right. Hate to leave on this question, but I have to because it's up here about several times. So, Doc, I don't know if we told you, but we can get political on here. And it says, do you think the previous occupants' attitude about COVID and the vaccine is the reason some people have not gotten vaccinated?
Absolutely. I struggle with anything that's going to make this political. But here's what I would say to the people who support the previous regime. I think they did a lot of things wrong with the pandemic. I'm a disaster responder, and our response to the pandemic was every state for itself. You find your own PPE, you find your own ventilators, you do what you want with masks. We saw Florida, Alabama, Ohio, New York, everybody doing different things. I don't think there was great national leadership. And again, I respond with FEMA. So I feel like I know this landscape. So that the every state for itself thing really bothered me. But if I was to say something positive, it really was that the development of these vaccines were revolutionary. To have a vaccine, to be able to have the genetic sequence of the coronavirus in January of 2020, and to have the resources and science to apply, the technology that we already had, study these vaccines, I think that's a great accomplishment. And I'm really surprised that, and if we're going to get political, we might as well just do it, that the conservative Republicans aren't trumpeting the fact that Operation Warp Speed has come up with these vaccines that have been life-saving. I mean, that really happened under the previous regime. And, so I don't think the Democrats want to give them credit for it. And I don't know why they don't want to take credit for it. But the thing that we have that's saving lives are vaccines. And it was, I think the name is silly because it scares people. It sounds like a Star Wars thing, Operation Warp Speed. But these vaccines were studied. And the whole reason we were able to do this was because of money, right? We were able to pump tons of money into the development of vaccines that some of them were effective and some of them weren't. And that was just money wasted. But I think it's unfortunate that this got political, that there are counties and states that have very low vaccination rates because of political parties. I think we got to get beyond that. But there is there's absolutely no doubt that there's a political component to this, and it's very unfortunate. That's all I can say.
Yeah, I agree with you. Well, yeah, we've run out of time. People stayed on, which means they were grabbing this, and there's normally about 1,000 replays after this. So hopefully people will tune in. But I cannot thank the two of you enough. So thank you, Dr. Command. Thank you, Jakeithia. I really appreciate you. We will have to have you back because I think you are outstanding, both of you. This has been a lot of great information. We're going to continue to do our part. Say that again, Jakeithia.
Thank you so much for doing this and for what you do.
Thank you. Thank you. Thank you. Thank you. We will definitely have you back. This community is growing, and I don't know if you're on the page, but there's a lot of information still coming on, and people are still posting. It's interesting. I could tell the stream was freezing every now and then, but we just kept plowing ahead. We just kept pushing forward. Just a few thank yous. Judy Neal, I believe she's in the Lorain County area, says thank you both. Our scientist says thank you. My brother says thank you. He just had brain surgery a couple years ago, and he was vaccinated. Other people are just saying thank you for this information. It was great information, that they appreciate you. And I personally just want to say thank you as well. Thank you for joining me and hanging out with me this morning, early in the morning. I know it is. We have what we call each day for the win. And we identify people who are doing great things within the community all over the U.S. and abroad. So both of you will share for the win today. So Dr. Command, Jakeithia, you both get for the win for just educating the people and encouraging them to get vaccinated or to get what they need to make a honest decision and not based upon what's out there on social media. So thank you. Everyone, you know what I say. Thank you so much for joining us. Thank you, thank you, thank you. Please share the video. It's not too late. Replays. Anyone who's watching the replay, if you have any questions, reach out to us and we will get you the information to get to the people. So y'all know what I say. Stay well, everyone. And remember, make some moves.